So I'm 42, so I started getting my mammograms at 40 and had 2 completely normal mammograms. So 40, 41 it was a year and a week after my last one. And I went in to get my mammogram done and thought absolutely nothing of it. Came home and then later that day got the call and have no significant risk factors. So that's where I wasn't worried at all. Even as a physician looking at it with the radiologist who did the biopsies, knew that it was most likely cancer and was shocked, I guess, as anyone is who gets an unexpected cancer diagnosis. And it was a day or two later that I got the results that confirmed that it was an invasive ductal carcinoma. So initially I was leaning more towards a lumpectomy, but then I decided to have a bilateral mastectomy. For me, that was the better choice, but I realized that it's not the better choice for everyone, and spent some time just kind of thinking through as far as the chances of recurrence. You know, if I did have a recurrence, a lot of different factors play in. I have a 3-year-old and a 6-year-old and a 14-year-old. Looking at all of those different things, for me being 42 and for me, the better choice was a bilateral mastectomy, but I don't want people to think that if they're in this situation that that's what they should do, because a lumpectomy is a wonderful choice too for many women who are in the same situation. Is there a risk factor I miss? So I have tried to practice really healthy lifestyle behavior. So I exercise at least 30 minutes every day. And I try to eat really healthy, lots of whole foods, lots of unprocessed foods, lots of plants. I don't drink alcohol. I have a good, strong support system. I don't smoke. So I try to do all the right things. And so I did the why me? I breastfed my kids. All these things. And then I did the why not me? 1 in 8 women in the course of their lifetime will have breast cancer. And we know there are certain things we can do that lower our risk, or not having a family history lowers our risk, but still there are many women who get breast cancer with no risk factors, with no symptoms, such as myself.